As a psychiatric provider, I often see patients in clinic that wish that they would have picked up on their depression symptoms just a little bit sooner. So today we're going to be talking about some signs that most people don't know about as it relates to depression. So number 1 out of the 5 would be irritability. Most people, when they think about depression, they think about sadness. They think about crying, being in a dark room, and being isolated. While that may be true for majority of people, there is a certain amount of people who develop irritability. So it's not sadness at all. So some people might notice that they're more verbally aggressive or snappy, or sometimes in children especially, the moms will come in and say, she's so sassy. But that could actually be a sign of depression. Some people I've heard describe it as having a short fuse. Second would be physical symptoms. So a lot of people don't think about headaches, pain, stomach upset as being a sign of depression, but it can be. This can make it hard for your provider to be able to pinpoint exactly what is the cause of pain. I know a lot of doctors and a lot of people probably think, oh, did you hurt yourself? Do you have any trauma? Or do you have arthritis? Or do you have an autoimmune disease? They'll think of other things before they rule it out as being psychological or psychiatry related. But that's just them doing their job, just ruling out any other possibility for you having pain in your body. But physical symptoms can always be tricky, always. Third, and this is common a lot in females, and I know you guys are going to laugh when I say this, but decision paralysis, i.e., what am I going to wear tomorrow? Or what do I want for dinner? I struggle with this myself. So I know it's going to hit home for a lot of people, but please don't freak out thinking, oh my God, I need to go get an assessment. I might be depressed. We're just going over these signs and symptoms. And if you have any questions, reach out to a local healthcare provider so they can do a proper assessment and see. But don't self-diagnose. That is not what this video is for. This video is for educational purposes only. Moving on to number 4. Number 4, memory issues. You might find yourself being more forgetful or more absent-minded, walking into rooms and forgetting what you came in there for. Trust me, I know. And sometimes it's not just stress related. Sometimes depression can really affect not only your executive functioning, but your cognitive functioning. Number 5, changes in your perception. Some people who are depressed, they tend to say, oh my gosh, the day was so long. I thought today would never end. Or either they'll be like, oh my God, the days flew by and I don't even know what day is it? What year is it? You know, I'm laughing in a way because that was like 90% of us last year. It flew by so fast and we all had the same consensus. Not saying you're depressed again, but I'm saying these are lesser known signs and symptoms that most people rarely count as being depressive symptoms, and they can be. So if you recognize several of these points, especially occurring for more than 2 weeks, consider reaching out to your local mental health professional. Early intervention can make a world of difference. Drop a comment below if you have any further questions or need me to elaborate on anything that's not medicine related. If you just want to share and keep the conversation going down in the comments, you never know who may come by this video and read the comments and also be in the same place you are. Or they might feel like nobody is in the same place that they are, and they come across your comment and it encourages them and it shows them that they're not alone in this world. And I thank you guys so much for watching. If learning more about mental health and self-improvement is your thing, then make sure to subscribe and hit that bell notification to be alerted when I drop. And I will see you guys on the next video.